JC Cantoja, first-year nursing student at Central Mindanao University. Today I am going to demonstrate the procedure in which I think is quite familiar with you. It is measuring your body temperature. There are 4 different ways on how we can measure our body temperature. Number 1 is measuring your tympanic membrane temperature. Number 2 is measuring your oral temperature. Number 3 is measuring your rectal temperature. And we're only going to do the procedure number 4, which is measuring your axillary temperature. But before we can start, we're going to do an assessment, which is to assess if the patient does feel hotness or feeling discomfort. So the possible nursing diagnosis for this one is that if you have high temperature, you have hyperthermia. And if you have low temperature, hypothermia. And now we're going to discuss the materials needed for this activity. Is of course, number 1 is the digital thermometer. The next one would be the probe for hygiene, and the alcohol-based hand rub, and the alcohol swab, and of course the gloves to prevent contamination. Since we're all set, let's start the procedure. Procedure number 1 is to check medical order or nursing care plan for frequency of measurement and order. The more frequent you check the temperature, the more accurate it is for the nursing judgment. So procedure number 2 is to do a hand hygiene to prevent contamination. Procedure number 3 is to identify the patient. This is to give the proper intervention to the right person. And procedure number 4 is to close the curtain if there is any, and the door if possible. This is to provide privacy and comfort to the patient. And also, you need to discuss the procedure to the patient and assess their capabilities and how they can assist you in this procedure. This is to establish a good rapport towards your patient. Procedure number 5 is to ensure that the digital thermometer is in working condition, since it needs to be in working condition to get the accurate result that we need. It is in working condition. Procedure number 6 is to wear the gloves. This is to prevent contamination. Procedure number 7 is to select the appropriate site based on the previous assessment data. Proper place for proper intervention. So we were going to do the measuring of axillary temperature. So for procedure number 8, we're going to follow the steps indicated for measuring of axillary temperature. For procedure number 1 in measuring the axillary temperature, you need to move the clothing up to expose the axillaria. This is for easy access. And for the procedure number 2 is to remove the cover of the digital thermometer and to insert the probe. This is for sterility and to prevent contamination and maintain cleanliness. Procedure number 3, place the tip of the probe to the center of the axilla and bring the arms closer to the body and hold the thermometer. This is to ensure that you record the correct temperature or accurate temperature. And this leads to procedure number 4, which is you're holding the probe in place until you hear the beep sound, and then carefully remove the probe. And after removing it, you need to note the temperature that was indicated in the thermometer. You need to take note that you need to be careful in removing the thermometer to remove further injury to the patient. we have it. You already heard the beep sound, and it is. Now we're going to record the data. For procedure number 5, you need to help to cover the patient and help him to a comfortable position. This is to ensure the patient's comfort. And the next one would be to dispose the disposable probe to prevent contamination. And clean it with the alcohol swab to maintain cleanliness in the next user of the gadget. Dispose the alcohol swab that was used and remove the gloves to prevent contamination. And perform hand hygiene. This is to prevent the risk of contamination. The next step would be is to help the patient to be back in his or her comfortable state. So you need to put the bed on its lowest position and help the patient lie down. This is to ensure the patient's comfort. And the last one would be to return the electronic thermometer to the charging unit, which is I'm gonna do it.